Hi, I'm Ash, but you can call me Icon for short. I recently made a video about disability, covering some basic concepts and terms, but in this video I wanted to address something that I felt was necessary to discuss. At time of writing, the United States is experiencing an ongoing pandemic, in large part thanks to the incompetence/eugenicist leadings of our leaders and continuing disinformation campaigns. Adequate precautions were not taken, personal protective equipment was in short supply when the disease first hit, testing is not widely available, and public health is being put at risk by pushes to reopen businesses. The United States' failure to adequately respond to this pandemic has resulted in the most transparent crystallization of ableism I can think of. In recent months, it has been made clear that disabled people will be deprioritized in favor of non-disabled people, largely due to judgments of disabled people's quality of life as being lower than a non-disabled person's. This value judgment is one that is not uncommon. Think about how many people talk about suffering from a disability, how they couldn't live with themselves if they were disabled, etc. This deprioritization of disabled people's care in response to COVID-19 is a borderline textbook example of the specific ableist idea I want to discuss here: disposability. Like, literally, this kind of thing was listed in my textbook when I took a human services course on disability. Disposability is a social position not exclusive or unique to disabled people, but it is one that disabled people seemingly always occupy, and this is largely because disposability is rooted in pity. Just as a quick refresher, pity is a specifically negative view of disability as being inherently burdensome. Disabled people viewed with pity are creatures whose entire existence is defined as suffering. It doesn't usually matter what the disability is, and it doesn't usually matter if the person actually experiences any pain as part of their disability. Disabled people are considered disposable because their lives are not viewed as being worth anything. From this perspective, their existence is equivalent to suffering, so disposing of them is sometimes even seen as doing them a favor. The disabled person may want to live, and people may be able to help them, but they will be allowed to die purely because their lives are not seen as valuable. This intersects with other attitudes. For example, disabled people are usually seen as a fundamentally unproductive class of people, so their death wouldn't hurt society or the economy. Disabled people can be seen in a more negative light as leeches, drains on our resources, and so their deaths can be justified as rationing supplies to save others. The fundamentally unproductive role disabled people have been given in society is one that is largely born of capitalist notions of productivity. Under a capitalist economic system, the priority of the economy, and many have argued of society more broadly, is the maximization of profit. Businesses in general exist to make profit, and if a business is not profitable, it is likely to be viewed as a failure. Disabled people, because of their relative lack of access to society, are not able to be maximally productive. This is not to say that disabled people are incapable of working well or effectively, but that they face unique challenges in society and the workplace that limit their productivity. If a job requires a lot of movement, people with mobility issues will not be able to do that job as quickly or easily as an abled person. Because disabled people are often unable to be maximally productive laborers, for some time now they have been relegated to a tenuous position of the worthy poor. The worthy poor are those in society who are unemployed and poor, but through no fault of their own, and thus should be helped by the productive members of society through some system of social welfare. This idea goes back a couple hundred years, but it naturally spawned an inverse that became a somewhat troubling concept. The unworthy poor, in contrast to the worthy poor, were people whose poverty and unemployment were seen as a result of poor character or incompetence, and their presence in society was not tolerable. Social Darwinists and their ideological relatives often sparked fears of these unworthy poor unjustly taking the charity meant for the more deserving, and thus positioned these people as leeches on society. This is part of why so many people test disabled folks to see if they're really disabled. They're seeing if this person is deserving of their charity, or a leech on others' good graces. This tension between the model, deserving, worthy poor, and the scheming, lecherous, unworthy poor has a hand in why society is so lacking in accommodation for disabled folks. The worthy poor were never really meant to be part of society in any meaningful capacity. They were supposed to be society's charity cases, living off the work of others because they weren't capable, in the minds of the public, of participating in society. Disabled people, thus, are put into a social role of non-productivity, and since a capitalist society has no need for people who cannot be, or are not expected to be, productive, they are therefore disposable. This functionally makes disabled people the cushion for society from facing significant consequences should something threaten the population. Social ills can be thrust onto disabled people by people in power, and this is unlikely to cause any meaningful problems for those powerful people. COVID-19 has illustrated this clearly, as many Republicans, including my own father, have argued over the course of the pandemic that the only significant threat is to disabled people, and we should not have to disrupt our entire society for this small group of already vulnerable people. This is, unfortunately, not merely a theoretical or abstract position. On June 11th, 2020, Michael Hickson, a disabled black man, died from complications due to COVID-19 in a hospital in Texas. His doctors and legal guardian, Family Elder Care, made the decision to put him in hospice care after his condition had worsened. In a recorded phone call between one of the medics and Hickson's wife, the doctor says that the treatment they could give Hickson would not improve his quality of life. Hickson's wife fought in court to be given legal rights to be in charge of her husband's care, trying to keep his doctors from giving up on him, but the judge placed Family Elder Care in charge of Michael Hickson's medical decisions. This case is appalling for many reasons, but it embodies a fear that disabled people have, that at some point, a decision will be made for them that their life is no longer worth living. The facts of Michael Hickson's case are disputed by the hospital where he was treated, and I'll have articles below you can check out to look into it. But what is indisputable is that his doctors emphasized his disability as something that lowered his quality of life, and used it as justification when speaking to Hickson's wife about placing Hickson in hospice care. Disposability is a social position disabled people occupy because their lives are assumed to be worth less than non-disabled lives. Fellow autistic YouTuber Faye Fahrenheit unintentionally gave a great example of how pervasive this attitude is when writing a post on Reddit detailing their thoughts around COVID and disability. Many of the comments underneath their post immediately assumed that either this was some sort of mistake on the part of Hickson's doctors, or that his life was being sacrificed for some greater good. Both of these responses highlight how disabled people are intended to be disposable, by illustrating that the immediate response to the death of a disabled person is callous indifference at best, and a myth of noble sacrifice at worst. Sure, this disabled person died, but it's not like they count. Even if they did, though, their doctors were making a tough call, doing what needed to be done, sacrificing their life for the greater good. A significant part of the problem with this mindset is the amount of deference given to doctors and medical personnel. Indeed, this problem was also part of why this happened in the first place. Doctors are supposed to be specially trained people who prioritize the well-being of their patients, and the popular image of doctors is one of overworked, earnest, well-meaning individuals. I don't mean to imply doctors or other medical personnel have it easy. The recent crisis has made it abundantly clear how ill-prepared our healthcare infrastructure was for this sort of influx of patients, and nurses and doctors have been under immense pressure in the last few months, working in often dangerous conditions without proper equipment. However, a reality that disabled people are often acutely aware of is the way doctors interact with patients on a regular basis. Based on the stories of disabled folks I know, as well as research into this issue, doctors are far too willing to ignore the concerns of disabled people, and are influenced by their own education and societal conditioning. Doctors are trained with an ideal human body in mind, one that functions within certain parameters, and disability is seen as a flaw to be corrected or treated, and society generally promotes the idea that one's relationship to their disability is hostile. It's unsurprising, then, that they may perceive a disabled individual's life as being of lower quality. They're like a damaged machine, not operating at peak efficiency, and the solutions one has when presented with a broken machine are to fix it or to throw it out. If your phone screen cracks, you don't accept it, you fix it or throw it out. Medicine in general has served to disempower disabled people for a few hundred years, as solutions focused entirely on what abled people could do to fix them, rather than find ways for disabled people to cope with their issues and integrate into society. This trend has partially altered course in the last 100 years or so, but the attitude is still ingrained in the institution of healthcare as a whole. The case I cited earlier had legal guardianship given not to the people who had Hickson's best interests at heart, or the people who advocated on his behalf, but the institutional body that is expected to know the best way to treat people. There's a can of worms I won't go into here about science in general being used as a tool of institutions to disempower the general population, but for now, medicine and healthcare in specific have ingrained prejudices toward disability that frame it as not only deviant or undesirable, but fundamentally incompatible with one's well-being. There are also a lot of racist ideas still being taught to doctors, which I can't not mention here, like that black people experience pain differently from white people, which almost certainly affected the decisions of Hickson's doctors. Hickson's doctors and the hospital where he received care strongly deny all accusations that their medical decisions were affected by Hickson's disability or race. But I don't exactly find these denials compelling when there is recorded evidence of one of Hickson's doctors emphasizing his low quality of life as a strong factor in their decisions. Michael Hickson was a human being. He was a disabled black man whose life was not valued by the medical staff entrusted with it. His wife and 4 children were forced by the courts to sit back and watch as their loved one died with no intervention, knowing that, at least in part, the decision to let him die was based on devaluing his life. Disposability isn't just some abstract concept, a theory that explains disabled people's role in capitalist society. It's a mindset that contributes to the deaths of disabled people. I wanted this topic to have its own video because it's a heavy one, and I don't like the idea of making it a footnote in a larger point. Michael Hickson deserved to live, and he shouldn't be relegated to being the third body paragraph in an essay about disability. The attitudes that underlined the decision to let him die are worth understanding, so that we can more effectively combat them. I'll have relevant links in the description to this video where you can learn more and show your support to Michael Hickson's family. Please note, the GoFundMe for Hickson's family at time of recording has reached its goal of $10,000, but if you have a few extra bucks lying around, I'm sure they wouldn't mind the extra support.